Welcome back. The entire month of September is National Suicide Prevention Awareness Month. Clinical
social worker Laura Potts joins us to share some resources available for children who might be struggling with mental health issues. Good morning, Laura.
Good morning.
Thank you so much for joining us.
Thank you for having me.
This is obviously a topic that nobody wants to talk about, and we wish that we didn't have to talk about it, but it is important to talk about so that families know where they can get resources before it gets to a critical point, and unfortunately, if it gets to a critical point. So what are some of those signs and things that we're looking for, when it might be building to that point?
Sure. Yeah, no one wants to talk about this, but suicide is the third leading cause of death in Louisiana for ages 10 to 24. It has become a huge part of my heart and our work at Manning Family Children's to ideally be able to intervene and prevent any type of crisis or mental health condition bubbling up. And so warning signs, common warning signs that I tell caregivers, teachers, coaches, anyone talking about a drastic change in behavior or mood, right? So oversleeping or undersleeping, overeating or undereating.
Anything that seems to be a big difference.
Big difference. For suicidal ideation specifically, a chronic sense of hopelessness, giving away certain, what word am I looking for? I'm so sorry.
Giving away,
like their
like negative self-talk, or
no, their belongings. Why couldn't I think of the word belongings?
Oh, giving away their belongings.
And I know that sounds really
it sounds generous or sweet, but they might be thinking
correct. That one is more common than you would think. And so I try to empower adults in our community to know what to look for and to also feel comfortable having direct conversation. There's a misconception that if an adult is worried about a youth having suicidal ideations, that using those terms in the conversation, right, like, oh, if it wasn't an idea before, what if I say it and then it is? But research has proven that is absolutely not true.
Talking about it can make them feel comfortable talking about it and kind of getting that out. Now, you mentioned some resources that Manning Family Children's has outpatient, where you're not in the hospital because it's maybe not to that critical point yet.
Of course.
So if you start noticing these signs, what can you do?
You can reach out to Manning Family Thrive Kids. I am one of the school programming managers at Thrive Kids. We are a community program of Manning Family. We have outpatient therapists that see youth ages 5 to 19 for counseling, both telehealth, so virtually from home if that's convenient, and in our in-person clinic. And then we also have over 42 mental health professionals working in schools all throughout Orleans and Jefferson Parish that can provide those services while the child's at school.
Yeah, kind of meeting them where they're
at. So just those, like you said, prevention, counseling, even if you're just worried about signs of depression, anxiety, anything.
Sure, because headed off at the pass of you can get to those kids before they get to that critical point. Now, if your kid is talking about suicide, or giving away their, and you've noticed that they seem really, really sad, or they try something, that's when you're at a critical point.
That is a true crisis.
What do you do as a parent or a caregiver when you find a kid at that critical point?
Absolutely. So when a child is in crisis, right, we expect no one to be a mental health professional or a physician other than, so you will bring them to, I say, the Manning Family Children's ED, where we have a special part of our emergency department that is specifically dedicated to psychiatric needs, where they will be evaluated by a physician and a social worker to see if they need further inpatient psychiatric care, because we do have a 51-bed behavioral health center at Manning Family Children's. It's the largest in the Gulf South, where children who need to be stabilized or provided some safety, right, are there to learn coping skills, are there to meet with psychiatrists and just have those needs met.
And important to note that everything at Manning Family Children's, it's a children's hospital. So everything is going to be, at that level. Everyone there is trained to work with children
specifically.
So you can kind of rest assured that you're getting the right help when you bring them there.
Absolutely.
Thank you so much for joining us.
Thank you for having me.